And we are back with Dr. Ray Powell from Physicians Plan Weight Management. Today we are talking about facial aesthetics, and we are, talking about some of the work that you would do for some patients. And, a lot of people are familiar with Botox, and we're going to talk about that right now. But some people out there may be saying, Dr. Powell, you're not a plastic surgeon or a dermatologist, but you do have a lot of experience doing these type of procedures.
Right. We all go through additional training for a lot of these procedures, and I'm also an emergency medicine physician, so I've done a lot of, technical procedures in the ER. So it's really more of the expertise of doing it, and we've been doing it now, and I've been doing it for over 10 to 13 years, depending on the type of procedures, really since they become FDA approved.
Okay, that's great. So they are in good hands when they come to see you for these procedures. Now, let's talk, we talked about the creams and then also some of the, facial peels and that type of thing. But now let's talk about what people have heard a lot about, and that's Botox, and then also another product.
Right, we have another product, which is a newer product called Dysport. And this picture kind of describes the aspects of wrinkles in one great picture. You're looking at wrinkles, but you're also looking at what the action of the muscle does to cause those wrinkles or lines. And so Botox has been around since about 2001 as an aesthetic procedure. It's actually used to be called oculinum back in the 60s. And so it's been around for a long time. We know what it does. Dysport is a newer product, which is basically a competitor for Botox. It uses a different part of the protein of the molecule, so it actually helps people that the Botox might not be working as well on. But Botox and Dysport both are really what I call preventive medicines. They're trying to keep the lines from forming deep. It's not to make you look paralyzed. It's not to make you look like some kind of freak of nature. It's to make you look healthy and really natural. So I've got some before and after pictures. This first one is showing a central crease that the woman gets that's kind of a familial trait that she has in her family. And by using small amounts of Botox around that muscle, you can see the one on the next side just is basically with her squinting also, and there's no line.
Now with a procedure like this, is this a one-time injection, or would you do this over a period of time?
It lasts about 4 months. It takes about 4 to 7 days to kick in, and it works for, it continues to improve about 30 days, but then it lasts about 4 months. So the way I describe it as a preventive medicine, if she comes in 2 to 3 times a year, it's going to keep that line from forming deep. The next one is a before picture, and the little black dots are where we're going to put the Botox in. And then the next picture after that is about a week later, where she's really trying to squint, but she can still show a little bit of action, but it's not causing the pinching.
Amazing difference, though.
Yeah, it makes a big difference. It just makes them look just healthier and less stressful. This next one also shows the pinching of 2 lines. They call this the number 11. And then afterwards, you can see she's really trying to squint, and she's not making those deep lines anymore. And any lines that are left will kind of resolve over time. So here's another before, deep lines. Afterwards, you can see with the next one where she's really trying to squint, but those lines that you still see will really gradually over time just kind of go away if she keeps the Botox up. The next one is a younger lady who's just starting to get the beginnings of that, and she's really starting to notice that line along her eyebrow. So then afterwards, you can see that she's just really kind of smoothed it out. So it's good for people that are even in their 20s and 30s all the way up into the 60s, where they're just trying to give back that healthy appearance to the expressions. And we can use it in the brow area, the forehead, crow's feet. We even do a little bit in the upper lips as well as in the bottom of the face.
And you were showing the photos from the younger woman there. And I was going to say, is this something that you should start earlier to kind of prevent this from happening, or is it something that you wait?
It really depends on the genetics of the person and their personal preference on whether or not they notice it and whether or not they feel like they need it. We leave it up to them.
Is there such a thing where you would have these, where you would have these procedures and you have them and then they stop working over time after a certain point they won't work?
Some people, maybe 5%, will notice that the Botox isn't lasting as long, and so that's when we'll switch over to the Dysport, because it's one where they're not getting kind of a resistance to it, and so the Dysport will work just as long as originally the Botox did.
I was wondering, say if somebody switches to the Dysport because the Botox isn't working so well, is it one of those things that you may be able to switch back and forth?
You can go back and forth, exactly. There's no problem with that.
And then one of the big questions I'm sure patients always ask about, you being a doctor, the pain factor. What do they have to deal with? What are they looking for?
My personal philosophy with any of these injectables as well as lasers is you don't get a a diploma for being in pain. So we make it as comfortable as possible. We use numbing cream, we use ice. We really take the time to defray any of the worries that the patient has, so it really goes quickly, and they just say, my God, that's it? You know, they had all this drama that they built up, but then when they have the procedure, it was just really quick and easy.
Yeah, sometimes it's just the anxiety is worse than the actual procedure.
Exactly.
So that is good to hear.
Right.
Well, Dr. Powell, you did mention lasers, so we are going to talk about those a little bit in the segment coming up. So we are not done yet. There's still much more to come here on North State Health, where we're going to be back in just 1 minute, so don't go away.